Hello, so today in this presentation I'm going to be talking about Parkinson's disease and the pharmacology and the pathophysiology behind it. So, the pathophysiology. Parkinson's disease is a neurodegenerative disorder that presents later in life in the form of bradykinesia, resting tremors, and rigidity. This disorder is associated with the loss of dopaminergic neurons in the substantia nigra and the presence of Lewy bodies. Only 10% of cases have a genetic cause, however most cases are idiopathic. There are a few key elements in relation to the pathophysiology of Parkinson's disease that I would like to discuss. So, firstly, pathophysiology. Firstly, the loss of dopaminergic neurons within the substantia nigra. The neurotransmitter dopamine is crucial for regulating movement. As neurons die, there is less dopamine present to communicate with other areas of the brain, specifically the basal ganglia. This plays a central role in coordinating controlled and smooth movements. Due to the reduction in dopamine, there is an imbalance in the indirect and the direct pathways, resulting in the motor symptoms of the Parkinson's disease. So, another pathophysiology is a neuroinflammation, which is the inflammation of the brain, which is also a contributing factor to the disease. The activation of the immune cells in the brain, the microglia, has been observed in areas of diseased brain, releasing pro-inflammatory cytokines that contribute to neurodegeneration. A third example of the pathophysiology of Parkinson's disease is the formation of Lewy bodies. Lewy bodies are clumps of proteins that build up inside certain neurons, brain neurons. In Parkinson's disease, Lewy bodies is the accumulation of misfolded and aggregated asynchylian in intraneuronal seclusion. And there's a photo right there of a Lewy body. Parkinson's disease is incurable and permanent. Currently, there are no disease-modifying treatments for Parkinson's disease. However, there are treatments used to minimize and relieve the motor symptoms. The primary current Parkinson's disease treatments are levodopa-based preparations, which are designed to replace the dopamine in the depleted stratum. However, dopamine itself isn't able to be prescribed due to its inability to cross the blood-brain barrier, the BBB, and cannot be used to treat Parkinson's disease. Instead, dopamine precursor levodopa can cross the blood-brain barrier, meaning it can be administered as a form of therapy. So, mechanism of action. So, the carbidopa-levodopa is the most effective medication used to treat Parkinson's disease. It is a natural chemical that passes into the brain and is then converted into dopamine. This drug is combined with carbidopa, which protects the levodopa from early conversion into dopamine outside of the brain, preventing the side effects such as nausea or lightheadedness called orthostatic hypotension, which is discussed later on. Levodopa is a part of a drug class called the central nervous system agents. Carbidopa is in the medication class called decarboxylase inhibitors. Carbidopa works by irreversibly binding pyridoxal 5-phosphate, inhibiting one aromatic amino acid decarboxylase as a PLP-dependent enzyme. The central nervous system takes up levodopa, however carbidopa cannot cross the blood-brain barrier, therefore showing effect of enzymic activity act only peripherally. So, considerations and route. So, this drug can be administered via oral tablet or oral inhalation or as an infused through a nasogenual tube. The levodopa treatment usually can cause nausea, dizziness, headaches, and somnolence. It is recommended, however, to increase the carbidopa to relieve the nausea, or doperidone can be of assistance if the carbidopa isn't as effective. With this drug comes many relevant considerations and precautions. So, levodopa is contradicted with the concurrent use of monoamine oxidase inhibitors, which are antidepressants, because it can lead to a hypertensive crisis, which isn't very good. So in the case study of Emma, she is not on any form of MAOIs, so this would not apply to her, obviously. But, some indications of this drug is being diagnosed with Parkinson's disease or Parkinson's from other sources, for example, caused by encephalitis or carbon monoxide poisoning, or in some cases it can be used for restless leg syndrome. So, carbidopa-levodopa can be taken with or without food, but cannot be taken with protein. Protein interferes with the body's response to the drug, hence why high protein diets should be very much avoided in this situation with taking this drug. So towards the end of a dosing interval, one may experience a wearing off effect, which can cause a lot of problems to one's everyday life. This medicine also releases its ingredients 30 minutes after being taken. Supplements such as iron salts, like in vitamins, iron tablets, they also may keep this medicine from working efficiently because they reduce the absorption of the levodopa. So the dose of this medication is different for all patients. Double dosing is not safe for this drug, so if one is missed, just skip the dose entirely. In relation to the case study of Emma, she is of the older population of 70 years of age. So forgetting, what dose or what the conditions are to taking the medication is quite likely. So specific education is always required with taking this drug, like any other drug, to prevent other issues from occurring. So it's good to remember that education is key, and thank you for listening.